Hello everybody, welcome back to our channel. I'm Dr. Amel from City Skin Clinic, and today I'm going to have a chat with you guys about lip flip. This is a really popular procedure at the moment, and in this video I'm going to discuss what a lip flip is, how it differs from lip fillers, and when it's more suitable to get a lip flip versus lip fillers, or when both of them might not be suitable at all. And I'll also talk about how long the differences, how long they last, the procedures, cost, risks, all of that good stuff. Before we get started, if you're new to our channel, welcome. Don't forget to subscribe and hit the notification bell. If you are an existing viewer, welcome back and thank you for all your support. So, what is a lip flip? Well, a lip flip is a Botox procedure, and I say Botox because that's the leading brand for botulinum toxin, and that's what we use in our clinic. We don't use anything else. There are other products like Azalure, or as it's known, Dysport, Bocature, but for this purpose I'm just going to talk about Botox because that's all I know, that's all I love, that's all I use in my clinic all day, every day. But please know that I'm talking about botulinum toxin injections. So, Botox lip flip involves using Botox anti-wrinkle injections, and these injections work by relaxing muscles. And the aim of the lip flip is you relax certain fibers of the main muscle around the mouth called orbicularis oris. This muscle opens and closes the mouth, so when you're doing, whistling, eating, whatever, talking, orbicularis oris, it's a big muscle and it is involved in this. So when people have a Botox lip flip, what that involves is a small series of injections. So what happens is sometimes this muscle, certain strands of it may be overactive, and that can cause the lip to be that may cause the lip to kind of appear smaller. It's kind of the position that the lip is held in. It may also, cause the top or the lower lip, or both of them, just to not be as visible as they normally would the full body. And so the concept behind the Botox lip flip is you relax a little bit around the lip, this muscle, and it could be the top lip, the bottom lip, both of them, depending on what you need, but most commonly it's usually the top lip, and then a couple of injections in the bottom lip, particularly around here, and that relaxes these fibers a little bit. And so when they relax, they let go, and so you see more of the lip. So what it's not doing is changing the volume of the lip, it's not changing the size of the lip, it's not changing the anything to do with the lip, but what it's doing is it's kind of making bits of the lip a bit more visible. So this treatment can have fantastic results, but you've guessed it, if it's used in someone whose lip is kind of being hidden by a bit of muscle overactivity. And so if you don't have this problem, then you're not going to see any benefit from it. So it's something that is worth knowing. It can also be used to correct a bit of asymmetry if one bit of the lip is kind of differently, one side of the muscle is more active than the other side. It's fantastic for that. So again, if this is the cause of your lip appearing smaller, a little bit asymmetric, then it's a fantastic procedure. If you don't have that issue, you're not going to see any outcomes, and that's why it's really important to go to a medical practitioner, someone who's experienced, who can advise from the beginning how likely you are to see any outcome and if this is an appropriate procedure for you. I wanted to say on that point, the Botox lip flip, it's not so different from gummy smile correction, and it's not so different from using Botox to help with a downturn. smile, and it's not so different from you. It's really similar to using Botox in terms of injection and procedure for to relax the smoker's lines around the lips, because these are all problems caused by the muscle activity in that area. And so by relaxing it a little bit, you're looking to stop the muscle either excessively pulling to cause wrinkles in the case of smoker's lines. And this is a treatment that we combine the Botox and filler in the smoker's line area to really smooth them out and give the lips some definition and crispness. It's also in the downturn that's caused not by orbicularis but another muscle, and that, if there's excessive, you get that kind of constant sad frown look, downturn corner of the mouth, and so that really works nicely. And then finally, gummy smile is when you have muscles above here that kind of insert into here, pulling up on the lip so much, the top lip, that when you smile you just see gums and the lip itself looks really thin. So in that scenario, Botox injections help relax and reduce some of that movement, that excess pull, and that relaxes it. So the lip flip is just a different muscle that we're targeting, but the idea is that when you reduce some of that pull, then you get a bit more of the lip showing. And it's fantastic because in the right candidate, it really can improve the shape or the definition and the appearance of size of the lip. It's not actually doing anything to those things directly, but in kind of relaxing some of that excessive pull, you're really giving the lip, you're kind of showing them off, giving them their best opportunity to shine. So that's one of the really big reasons why a Botox lip flip has been really popular, and I'm sure you've seen lots of images on social media before and afters. But like I said, it really depends on it being used in the right person. So how does it differ from lip fillers? Well, the most obvious one is with lip fillers, you're using lip fillers, and with the lip flip, you're using Botox. And with the lip filler, what you can do is actually, to a degree, make changes in the shape of the lips. You can increase the volume of the lips, you can increase the projection of the lips, you can improve the shape, the definition, all of those things. So with lip filler, the way I'd like to think of it, with lip filler, you're replacing if there's something that's lost or not there. You're adding in terms of volume if that's needed, definition, shape. It allows you to create on the base that you already have. With the Botox lip flip, what you're doing is you're kind of preventing something from happening that's causing an undesirable outcome. So in this case, the lips looking thin or asymmetric because of excessive pull by muscle fibers. So lip filler is really letting you kind of do things to the lips that they don't already have, and that could be volume, it could be definition, it could be shape, it could be changing the height or the width. Again, within reason. You can't completely change anyone's lips or completely, you can't completely change someone's lips, but you can do quite a lot with lip filler. And with the lip flip, so that's Botox injections. I would say the lip flip is much quicker. It may take as little as 5 minutes, maybe even less, because it's only a tiny number of injections. You're injecting Botox, it's not painful and it's very quick. And they may use numbing cream, or they might not, they might use a bit of ice, whatever. So it's a really quick, it's no different to having Botox kind of maybe around your eyes or somewhere else, just to, or forehead or whatever, but probably even fewer injections. You also won't see any results straight away. So with a lip flip, because it's Botox, you have to wait for several days, and usually it'll take about 2 to 3 weeks for the maximum result to be apparent, because you need to wait for the muscle to relax. With lip filler, you see an immediate result because the lip filler's gone in there, but usually with lip filler or any type of filler, there's swelling, and that goes down after a few days or even a few weeks, depending on what was injected and where. And then once it settles to its final shape, the result is there. With lip fillers, again, it depends on the results. It depends on the type of filler, but could last anything from 6 months up to 12 months or more. So up to 12 months or more, and it depends on the product that was injected. So if you have something that's longer lasting, like Volbella, that's at least 12 months, at least 12 months on average. If you have the Botox lip flip, Botox only lasts about 3 to 4 months on average, and some people that may be less and some people maybe more, but it's a much more short-lived procedure. And so if you want to maintain it, you need to perform it every 3 to 4 months, however long it lasts for you. When both of them don't immediately go, so with Botox you just start to notice that the activity returns until it's completely worn off. With lip filler, they dissolve slowly over time, and one day you'll notice a difference, either looking in the mirror or looking at a photo of yourself. So that's kind of the two main things. In terms of risks, look, Botox and filler, even in the best trained person, the best hands, they are largely safe procedures, but there are lots of things that can go wrong. And so with Botox, and filler, things like allergy, bruising, infection, Botox, you can, if you put too much Botox and you over relax the muscle around the mouth, the problem with that is you may end up with difficulty closing or opening your mouth properly. You may end up with some drooling. So that's something to really be aware of in a treatment like that. And with Botox, you have to wait for it to all wear off, so you can't reverse that. So if you did have an asymmetric smile, or you had some drooling because you couldn't, there was too much Botox, or it migrated to other bits of the muscle that we didn't want, then you could end up with that for a few weeks, maybe even a few months, until the Botox completely wears off. So that's something to be really aware of, and when you're speaking to your practitioner, you need to ask questions, how often could this happen? If it happened, what would we do? And like I said, to be honest, with Botox, there's not really much you can do other than wait for it to wear out, certainly in this area here. With lip filler, you don't necessarily have that problem, and with lip filler, if anything goes wrong, you can dissolve it as long as it's hyaluronic acid lip filler. And like I've always said, no one should be injecting anything that's not hyaluronic acid in the face. So if there is a problem, you can inject it, but one of the things that you're always aware of with lip filler is, because you're injecting this solid product, then if you're not aware of the anatomy, if you're not experienced, there's always a risk that you could inject into a blood vessel and either block it directly or indirectly with the filler, and that's a medical emergency. So if that's not dealt with immediately, you can end up with skin loss and tissue loss in that area. So again, these risks are super rare, thankfully, but they are only really rare if you go to someone who is medical, who is qualified, who is experienced, and who also has an emergency plan. If something goes wrong with the filler, they can dissolve it immediately and make sure that you're safe. If anything happens with the Botox, they can offer you aftercare, etc. And again, forearmed is forewarned, so if the more experienced you are and the more qualified you are in doing something, the less likely things go wrong, because you're just much more careful and more aware of what could go wrong, so you take steps to prevent it. So in summary, lip flip, it's a quick procedure. You don't see the results straight away, and they last for about no more than 3 to 4 months on average, maybe a bit less, maybe a bit more. And it is great if you don't require volume. You're not looking to really change the shape of your lips. You're just wanting to improve the appearance of them, make them look bigger without making them bigger. And if the cause of your lips looking smaller or asymmetric is because there's kind of pull in that area, excess pull of that muscle, it's fantastic for that. And you don't have to worry about overdoing it with volume, etc. And I'd say, so that's a great procedure for that. Botox lip filler is fantastic if you do want to add volume, you do want to do work on shape and definition, or if you want to enhance the appearance of your lips, but there is nothing to flip because there isn't really any overactivity that's causing the lips to look smaller or asymmetric. So it's fantastic in that regard. You know, you can also combine both of them. So if you need a bit of everything, you want to use a flip to kind of bring out the lips a bit more, but you also want a little bit volume, you can have also a bit of lip filler with it, and that's a great combination. It can also be combined if you're someone that has, for example, a gummy smile. You can combine that with the lip flip or lip fillers or both. If you have smoker's lines, to be honest, that is effectively the same technique as a lip flip, but just with a little bit more to target the lines. And the filler in our clinic that we use alongside the Botox is also designed to not only smooth the lines but also increase the definition of the lips as well, and make them look much more shapely and much more defined and nicer. So I hope you found this video useful. I will leave some links below on Botox, on lip fillers, on gummy smile, and things that I've mentioned in case you want some more information. And if you have any more questions about lip flip, about lip fillers, about anything aesthetics related, please leave a comment below. If there are any videos that, any topics that you're interested in seeing as videos, please leave a comment and let me know. If you haven't already done so, please don't forget to subscribe to our channel and hit the notification bell. Until next time, stay beautiful.